Hello friends, let us now learn some important points about a procedure called as T-tube cholangiography. In T-tube cholangiography, this T-tube cholangiography is a type of number one direct cholangiography. Okay, because it is a direct cholangiography, it helps or it allows the study of common bile duct. Okay, it is useful for studying common bile duct in post-operative period. Okay, this is generally done before or prior to removal of T-tube. Before you remove the T-tube, it is done. Why? Because to make sure that this common bile duct is patent or not. Done for patency of common bile duct. To make sure that it is patent, so that if you remove the T-tube, then obviously the patient can survive with the common bile duct, because if it is patent, the bile from the gallbladder, it enters into the intestine, and as a result the fat digestion under the general works of bile can occur normally. Now, if the patient has some if the patient has some type of issue and a CBD operation or surgery is done and a T tube is inserted, and if there are no post-operative complications to the patient, if there are no post-operative complications, then we can do this T-tube cholangiogram, which we are going to learn. This can be done in 8 to 10 days. It is done 8 to 10 days after surgery. After surgery, within 8 to 10 days, we can do this T-tube cholangiogram. Then, approximately, if you do 5% of these cholangiograms, which are done post-operatively, these 5% of these cholangiograms will show retained caliculi, according to some article. Then, if there is this retained caliculi, then what do? If there is retained caliculi, you can remove the caliculi by a percutaneous removal. You can do a percutaneous removal can be done through the T-tube only. Through T-tube, you can remove the stones percutaneously. Okay, this is also the treatment of choice for retained caliculi. Then, what are the indications? When do you do this T-tube cholangiogram? Number one, it is done whenever there is exploration of bile duct. Due to any reason, if you explore the bile duct at operation, to make sure that the bile duct is patent, we do this T-tube cholangiogram. Second, if there is poor or absent drainage of bile, normally there you have done an operation, you have put a T-tube. But after putting T-tube, if you see that there is poor or absent drainage of bile is seen from T-tube after operation, then in order to know if the T-tube is blocked or not, then in such cases, if the T-tube is blocked or if it is not present in CBD, to make sure that T-tube is present in CBD and it is not blocked, you will have to do this T-tube cholangiogram. Then, if there is any hemorrhage in the T-tube, if there is any type of hemorrhage is noted in T-tube, then to know the cause of hemorrhage, we can do this T-tube cholangiogram. Then it is also done in order to demonstrate residual hematoma. If there is any residual hematoma, in order to diagnose or demonstrate this residual hematoma, or if there is any abscess formation in liver parenchyma after the surgery, or like this is mainly done in why do you have to demonstrate this is demonstrated after partial nephrectomy, sorry, after partial hepatectomy. If the patient has undergone partial hepatectomy, which is removal of part of liver, or if the patient has undergone liver have some injury, and if the patient has had liver laceration. In both these conditions, in order to make sure, or in order to see that whether there is any residual hematoma or abscess left in the renal parenchyma, you can do this T-tube cholangiogram. So this is some important points about the operation and indications of T-tube cholangiogram. Thank you.